Hello, my name is Stephen Van Vliet. I'm a member of the Canadian XLH network, and I'm here today for a Meet a Board member. Today with me, I have Carol Nisbet. Hi, Carol. How are you?
I'm great. How are you, Steve?
I'm good. Good to see you.
You too.
Um, Carol, tell us a little bit about your role with the board for the Canadian XLH network.
Sure. So I've been on the board since the beginning. I was one of the people that was lucky enough to meet in a group meeting, and I believe it was through McMaster a few years ago.
In
And
Hamilton, yeah, I was there.
yeah. So I met you and your wife there, and that was great. Um, and that's where kind of this rudimentary idea of we all need to stick together and do some work. And since then, the board has blossomed, and I've been, lucky enough to be able to be involved and help have a voice to spread awareness about XLH. So that's been great. So I've been here since inception, so to speak.
Yeah, founding member. It's awesome.
Yeah.
I remember that meeting. It was so great to meet so many other people there as well.
And really interesting to see. So I know, Steve, you've had a similar experience. My family members have never met anybody else who has XLH. And
yes,
just to see that recognition as, they looked around the table and saw other people, that looked like them, that had similar experiences, that could relate was astounding. It was very moving.
Yes.
To be
as caregivers, I know it can be powerful for us because not only are our loved ones meeting people with XLH, but we're meeting people who live with people with XLH.
Yeah, and it can be such an isolating condition. So just being able to see that and help other people now connect is a real blessing.
Mm-hmm.
My partner has XLH. She was a spontaneous case, and then we have 3 generations in our family.
Wow.
Yeah. The youngest is 4 years old.
Oh my gosh.
Yeah.
And so how has the network, do you think, helped you or affected you and affected the family? My goodness.
Yeah, so many ways. Just that initial piece of, you're no longer alone, right?
Mm-hmm.
I have people like yourself who I can talk to about, what the stress is and what the excitement also is about, having somebody in the family with XLH. And when we make these small triumphs, recruiting people to our board, getting new members, learning about different treatments. It's great to be able to share that with somebody, but it's also great to be able to talk to somebody who knows, what it's like to walk the walk beside someone.
Yes.
And then just seeing my family be able to connect with others. As much as, I'm a social worker, I feel I'm a pretty empathic person. I can never say that I fully understand, nor will I ever fully understand their experience.
Yeah.
But I can certainly see how much it helps for them to be able to talk to each other and just explore what's going on with them with somebody else who truly gets it. And I think that's one of the key benefits to this organization.
Yes.
Mm-hmm.
I agree. I know since it's come into play, or since the Canadian XLH network has come together, there's been greater visibility for Crysvita, and I know a lot of the members have had access to that.
Yeah, that's been one of the true blessings. Certainly, there's been real benefit that I've seen with different members and their ability to just be able to function better. Certainly, the quality of life has definitely improved, and that's been great.
Yeah,
and getting that word out is so important, that there are treatments. Mm-hmm.
Yes.
Again, because I am a social worker and I'm working in primary care. I have a little bit more of an understanding of the healthcare system, certainly in Ontario. And part of the role I've taken on is to look at, some of the unique characteristics of physical and emotional aspects that our members might be dealing with, in the hopes that we can maybe create, sometimes when we're making documents for these letters to the MPPs, right? We have information now, like this is what our members are experiencing: multiple surgeries, certainly different issues with their teeth, definitely some migraines. And then, as Carly mentioned in her interview I saw recently, that mental health piece is extremely important. often
Yes.
overlooked. And that's an area I'm quite concerned about as well. So I have the luxury of being able to talk directly with doctors in the medical profession about different ways we can also advocate and spread the word.
Can you speak for a bit about the, I think you had talked about a healthcare team. I can't remember the
Sure.
terminology used, but having a team of doctors and medical professionals helping people out.
Yeah, so I work for a family health team, and a lot of individuals actually are members of family health teams, but may not be aware of that unless you actually ask your doctor, do we have family health teams in your clinic? If you do, the things that you're immediately able to access would be social work. We have occupational therapists, there's dietitians, there's respirologists, there's pharmacists. All those individuals would work with a team with your doctor in order to support you. But also, along with that, there is such a thing as called a coordinated care plan, that if anybody connects with the LIN, so the it used to be called CCAC, but if you go to the hospital, you can ask to speak to a social worker, and they could start a coordinated care plan, which would involve getting all your specialists together on the same kind of information path to share updates and information as your health changes throughout the spectrum. And once that happens, on the electronic medical record system at the hospitals, there's actually a little flag that would tell each doctor as you're seeing them, you're part of a coordinated care plan, and it might make some of your information easier to share. So that's just one of the things that I'm familiar with, but that other people might not be, and it might be helpful to know that. Anybody wanting more information,
I'd love to hear more about that.
Yeah, people could just reach out directly to the board, and I can certainly help somebody navigate pieces like that. I'd be happy to do that.
That's a great idea. So yeah. I love that idea. We get some of that at Sick Kids with my daughter, but I don't get that sense that it's a common thing across members. So.
And the hard piece is that you have to not only navigate this disease yourself, but you have to be able to advocate for yourself, and it's just the strength and even the knowledge sometimes of how to do that and when to do that can be really challenging. So, I know that's one of the goals with our board, is to help people be able to advocate better, and for us to help advocate with them.
That's great. Yeah. Is there anything else you'd like to say with regards to XLH, with the XLH network here in Canada?
Yeah, so the one thing I really wanted people to know, so curiously, I work in a primary care office. I work with 10 other doctors. My family are the XLH patients in that clinic. I have been there for 5 years and had no idea that there are other families at that clinic who also have XLH.
Wow.
And it's because of the privacy in healthcare, and we need privacy, but we need to spread the word about XLH. So if I could convince people to, every time you see a specialist, every time you see your doctor, let them know about the Canadian XLH network, and they could pass that along to other patients that they have, and encourage them to say, tell your patients to reach out to social media and find us, so that we can all work together. And we know there's people we're missing, and we just really want to help everybody. And we need to, the more numbers, the easier this work will be, and the more support for everybody. So
yeah, and I say the more connected I think that we all can feel.
Yeah. So pass the word. So that's my little soapbox. Pass the word, everybody, and make sure people are informed.
Well, thank you so much for your time today, Carol. It was great to talk to you.
You too, Steve. Thanks a lot.
Take care.